Hello, I would like to present about pulmonary tuberculosis case study. The aim of tuberculosis is to raising awareness about tuberculosis, to prevent its spread and have lower tuberculosis rate around the globe, to learn how the tuberculosis been diagnosed, to learn more about the tuberculosis. The case that is about to discuss here revolves around patient diagnosed with pulmonary tuberculosis. The patient that was teacher, Mr. Anna, was a 55 years old. She was a Malay. Her body mass index value is 56 kg per cubic. Based on her height of 1.58 meter and weight of 65 kg indicate that she fell into the overweight range. She presents symptoms such as shortness of breath and her respiratory rate was 20 breaths per minute. She appeared pale and weak and her glucose level were low and her blood pressure value indicate she was hypertensive. Upon physical examination, mild leg swelling was observed. Based on her past medical history, patient was diagnosed with pulmonary tuberculosis for the past 2 months. Upon inquiry, she seemed to be a non-smoker and non-alcoholic patient lived with her family. Pulmonary tuberculosis is infection with Mycobacterium tuberculosis result most commonly through exposure of the lung of mucous membrane to effect aerosol. Droplets in this aerosol are 1.5 micrometer in diameter. In a person with active pulmonary TB, a single course can generate 3,000 infective droplets, with as few as 10 bacilli needed to initiate infection. The health team member involved is doctor, lab worker, nurse. Ethical consideration. Government have an ethical responsibility to ensure free and universal access to diagnosis, treatment and care of TB. They also have to ensure the healthcare worker operate in a safe environment. Patients are enabled with proper support to fulfill their responsibility. These obligations are grounded in their duty to fulfill the human right to health. Not only does TB treatment significantly improve the health condition of individuals, stopping the spread of disease also benefit the broader community. Secondly, people need to be fully informed and counseled about their TB situation. Individuals have a right to bodily autonomy, therefore people undergoing TB testing and treatment should receive complete and accurate information about the risk, benefit and alternative available to them, and access to all means which enable informed adherence to treatment. Thirdly, healthcare providers have an obligation to support patients to complete therapy and offer all possible treatment options. Any tool to ensure adherence to treatment, including directly observed therapy, and should be based on the patient-centered approach so that value and need of patient regard that care delivery, respecting autonomy and privacy. Fourthly, healthcare workers have obligation to provide care but also a right to adequate protection. Healthcare workers have an ethical obligation to care for their patient even if doing so involves some degree of risk. However, they should not be expected to assume risks that result from inadequate conditions to provide care. And involuntary isolation should never be a routine component of TB program. TB treatment should be provided on a voluntary basis, engaging the patient in the treatment process and respecting he or she autonomy. If a patient refuses treatment, this is likely to be due to insufficient counseling or lack of treatment support. prioritizing of TB research to be conducted in an ethical manner. Continue development of the enhanced evidence base for TB diagnosis, prevent, treatment and care is urgent in order to continue improving the standard of TB care, including development of point-of-care test, new drug and vaccine. Treatment. For initial empiric treatment of TB, start patient on a 4-drug regimen: isoniazid, rifampin, pyrazinamide, and either etabuterol or streptomycin. Once the TB isolate is known to be fully susceptible, etabuterol or streptomycin, if it used as a 4th drug, can be discontinued. Patients with TB who are receiving pyrazinamide should undergo baseline and periodic uric acid assessment, and patients with TB who are receiving long-term etabuterol therapy should undergo baseline and periodic visual acuity and red-green color perception testing. The latter can be performed with a standard test such as the Ishihara test for color blindness. After 2 months of therapy, pyrazinamide can be stopped. Isoniazid plus rifampin are discontinued as daily or intermittent therapy for 4 months. If isolate isoniazid resistance is documented, discontinue isoniazids and continue treatment with rifampin, pyrazinamide and etabuterol for the entire 6 months. Therapy must be extended if the patient have cavitary disease and remain culture positive after 2 months of treatment. Direct observed therapy (DOT) is recommended for all patients with DOT. Patients on the above regimen can be switched to 2 to 3 times per week dosing appear and initiate 2 weeks of daily dosing. Significance of study. To learn about how dangerous the disease is if not treated. Knowing how to avoid being exposed to the disease. Learn more about what tests should be taken if they are affected by this disease. Personal development. Take care of your own health better so as not to be affected by the disease. To study more profoundly about the disease. New technique. Antigen detection test like LAM ELISA urinary and sputum antigen test. Microscopic visualization of bacteria like LED and bleach microscopy. Culture-based detection test like microscopic observation, drug susceptibility assay, thin layer agar, page-based test, colorimetric media. The discussion. The level of erythrocyte sedimentation rate is 55 mm per hour, higher than the normal range that is below 25 m per hour. This is because a non-specific marker of inflammation associated with conditions such as infection, cancer, and autoimmune disease. The C-reactive protein is 59 mg per liter, higher than normal range that is below 6 mg per liter. This is to detect inflammation. CRP is an acute phase reactant, a protein made by liver and released into the blood within a few hours after tissue injury. The start of an infection or other cause of inflammation. The sputum acid file bacillus show positive in tests but lower when the patient do the treatment. The result of certain tests in kidney and liver show that increase in tests caused by inflammation, malnutrition, bacterial infection, and bleeding. The discussion is the level of erythrocyte sedimentation rate is 55 mm per hour, higher than the normal range that is below 25 mm per hour. This is because the Erythrocyte is a non-specific marker of inflammation associated with conditions such as infection, cancer, and autoimmune disease. The C-reactive protein test is used by the doctor to detect inflammation. CRP is an acute pace reactant, a protein made by liver and released into the blood within a few hours. After tissue injury, the start of the impatient of other cause of inflammation. The patient have high level of CRP, 49 mg per liter, than the normal range of CRP that is below the 6 mg per liter. The sputum acid fast bacillus show positive in test but lower when the patient do the treatment. The result of certain tests in kidney such as AST, GGT, and in liver, that is albumin chloride, show that increase in tests caused by inflammation, malnutrition, bacterial infection, and bleeding. The conclusion show that the result of the patient is positive of pulmonary